To use Blue U, you need to purchase a Blue U device, whereas daylight PDT is free. You don't have to buy any expensive equipment, and it is pain-free. Two of the main issues with regard to Blue U PDT. A patient with photodamage, with actinic keratoses, will present with a number of these keratoses on their face, but actually it's not just one or two little keratoses, it's a field effect that we have. The whole area is being sun damaged, and so why are we just treating one or two little keratoses? The better thing is to treat the entire field. So consequently, daylight PDT, particularly since it's so abundant and so all around us, can effectively eradicate those keratoses. What happens is the patients will come in to the clinic and they will incubate for about an hour, and then we apply a sunscreen against UVB, UVA about half an hour before they leave to go out to their backyard, and frankly they can sit in the shade for those 2.5 hours. They should not go indoors for more than 5 minutes, otherwise the protoporphyrin levels will build up and it might be a bit uncomfortable. But the whole thing about daylight PDT is that you're gently activating the protoporphyrin. It's not the Blue U type of activation for 16 minutes, which is really quite painful. So in that sense it works very well. There's zero pain, it's just as effective, and you don't have to buy a device. We found out that the people who did the best with daylight PDT were those who actually, even though they were told to stay indoors for 48 hours, they cheated. But they got more of a reaction, and actually they did better. There were fewer actinic keratoses, their acne cleared up faster, and so forth. So we've actually put into it now a cheat period of 10 to 15 minutes on the second day as well. There are other ways of treating sun-damaged skin in a field effect manner. You can use the new Picado, ingenol mebutate, for instance, in a 5 by 5 centimeter square area. This you can treat a much larger area with daylight PDT, and it's just 2.5 hours being out in the sunlight, and it's very predictable, and the results that you get are just as good as traditional photodynamic therapy, and of course you don't have to pay for the sunlight. So I can see field effect treatments like daylight PDT becoming much more utilizable. After all, it's a pretty simple and effective treatment, and it's something that can be performed essentially by your assistant or physician extender. So I think that's going to actually make it a lot more efficient and a lot more affordable for whichever sort of healthcare we have in the future. Right now it's difficult for physicians to actually afford to do it because they can't monetize it. They can't really charge for it like they can for freezing of actinic keratosis.